Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Time for the weekly update. Now I know it's a few days late, but I waited to get a clear view of where we were. Remember last week there was a bump in cases, it wasn't clear what that meant. Veterans Day there was no case reporting. The summary is that cases are increasing in many locales around the country and the region. They were down in many western North Carolina counties as of last week, but now beginning to creep up, and they plateaued here in Haywood County. So, what clues does this give us about the coming winter? Well, if you hadn't seen video number 186, please go back and take a look, because that's a look at all the factors you can follow to get a read on where we may be headed in the holidays and into the winter. So please share this with someone you care about. Across the United States, 28 states now in red. Alaska no longer the highest rate. They've fallen substantially in the last couple of weeks. Minnesota now the highest rate this week. 67 states in the orange, 5 in the yellow, none yet in the green. For our neighbors, Tennessee up a bit and quite a few more counties in the red. South Carolina, only one county in the red. And Georgia, one of the 5 states in yellow, with the majority of their counties in yellow. North Carolina up just a little bit, 17 counties now in the red, 69 in the orange, and 14 in the yellow, some of them here in western North Carolina. And note cases now starting to go up a bit, causing a lower decrease in the rate of cases. So they look like they're going down, they're just not going down as fast, showing that they're actually going up. And deaths, thankfully, down at last. In western North Carolina, briefly last week, there were 4 counties in the yellow: Graham, Cherokee, Clay, and Madison. But as of today, none of those are still in the yellow. Swain and Jackson with the big moves since the last update. Swain all the way down into the yellow, and the only county in western North Carolina that is there. Clay, however, one of those in yellow last week, particularly close to leaping all the way through orange and back into being in the red zone. And Madison has bounded today back into the red zone as of today. As far as testing, North Carolina, briefly below the 5% threshold, now up above that. There are 5 western North Carolina counties still below the 5% threshold, but note Haywood has never gotten below 7%, even as the cases have come down. And for Haywood, now 7,679 for the pandemic. That's an increase of 87 over the past week. A slight uptick from last week when we were at a rate of around 14 per 100,000 population. Again, now we're up to around 18 of that. And now with the 3rd highest rate and the highest test positivity rate in the region. We have been at a pretty steady rate here in Haywood County of about 9 new cases a day for the past couple weeks. We've also had a sustained test positivity above 7 for weeks now. We may well be headed higher, and today may be the start of that, as we had 18 or 19 cases today. Deaths now 152 for the pandemic, 2 added this week, 2 fellow citizens in their 50s. Not vaccinated, I might add. Haywood Regional Medical Center had only 2 COVID-related admissions as of today, and none in the ICU. And that's after weeks of as many as 25 to 30 COVID-related admissions and as many as 3 to 5 people on ventilators. Even as the cases were coming down, so this is really good news for us. And take a look here at Europe. Cases are up 50% across Europe. But in the countries with good vaccination rates, the deaths have not gone up. In the European countries with low vaccination rates, unfortunately, deaths are well on the way up. And as you can see, the UK starting up again and starting from a higher baseline with this spike. So right now, it's not totally clear where we are headed, but look at the case curve across the entire pandemic. Surges start slow, and once a critical amount of infection is present in the community, it takes off exponentially. We're now a little higher than we were before Thanksgiving last year as we go into Thanksgiving. And our cases are down and lower than they were earlier a few months ago. But were we looking like the UK again? Like them, we have not yet returned to the low baseline we saw last summer. Now, there are those who feel we will never get to low sustainable levels, except we were there last summer. And Georgia is there now. And several western North Carolinas were just there, western North Carolina counties were just there last week. So why would someone think that it's not possible? Is it inevitable that we repeat last year? We clearly know what it takes and how to get to a sustainable low level of infections. And in the next 2 days, I'll be putting out a checklist to rate the risk you might be taking on over the coming holidays. That way you can decide how comfortable you will be, and if not, what measures reduce your risk and the measures you want to take. So be well and be careful, especially right now.